So, today we have with us Professor Fred Rivara from the University of Washington. We are about to begin our interview under the subject of global burden of injury, and the questionnaire is based on selected questions submitted by the pediatric community on the Excellence in Pediatric website. Professor Rivara, welcome, and let's begin with our first question. What is your opinion in regards to the extension of the age range for using rear-facing child car seats recommended by a recent article at BMJ?
Well, there are good data to show that occupants of any vehicle, whether it be a motor vehicle or an aeroplane, are safer when they're rearward-facing than when they are forward-facing. Data from here in the United States have shown that children who are in rear-facing car seats who are less than 2 years of age have about a 40% lower risk of being injured if they are rear-facing than forward-facing. So it is good to have children rear-facing. However, there are some issues associated with that. One is this acceptable? A lot of parents like to see their child's face when they're driving in the rearview mirror, and so there's some opposition to turning the child around and be rear-facing again. And secondly, many of the car seats for these younger children are okay rear-facing up to about 20 pounds. But when the child gets to be about 10 kilograms or so in weight, these car seats have to be switched to be forward-facing. I think there is some issue about availability of the proper kind of car seat as well.
Okay, question number 2. Could you advise on publications of evidence about the effectiveness of office-based interventions, mainly primary care, to prevent injury in young people?
The best work on this is being done by Denise Kendrick, a physician in the United Kingdom. And she has published a number of studies, including a Cochrane review and some meta-analysis. One in injury prevention in 2009 showed that having counseling in the office was effective in decreasing the risk of injuries. The counseling, though, however, should be around specific advice. For example, parents obtaining smoke detectors, parents fitting fire guards to fireplaces, parents using car seats, or parents lowering hot water temperature. So office-based counseling is effective, but it has to be very specific in terms of its information to parents.
Okay, thank you very much. Question number 3. In minor head injury, how helpful is a CT scan as a diagnostic tool?
There was a very good article published in The Lancet in October 2009 by Nathan Cooperman and others. And this was a large study of children coming to emergency rooms with head injuries. It analyzed about 42,000 children. And these were all children with minor head injuries. And it showed that a prediction rule for children 2 and older, if they had normal mental status, no loss of consciousness, no vomiting, not a severe injury mechanism, and no headache, that their risk of having a finding on the CT scan was very low. So while CT scans are useful, a prediction rule which excludes children with any signs of severe injury can virtually eliminate the need for CT scans. However, in children who do have minor head injury and have CT scans, this study also showed that these children did not need to be admitted to the hospital for observation, that none of these children were later at risk of developing more severe consequences. So I think that a number of CT scans can be eliminated using their prediction rules, but of those who do get CT scans, the need for admission is very, very low.
Thank you very much. We're moving to question number 4. What is your recommended surveillance approach of an infant who sustained a minor cranial injury? Example, head trauma due to a bed fall.
Well, first of all, there have been a number of studies on this to show that the risk of head injury in these children is very, very low. I think that the physician seeing these children does have to always be concerned about the possibility of child abuse. We see children come in with abusive-related head injuries, and the common story is that the child fell off the bed. But for children who do truly have those minor kinds of head injuries, children that have no scalp hematomas, who have normal mental status, and have no palpable skull fracture, those children do not need CT scans.
Okay, moving to question number 5. How can one work on developing a universal program for global injury program? How can all countries work together for this initiative? Should it be a different organization, or could it be under the auspices of an international pediatric association?
The World Health Organization has been working hard on trying to intervene for prevention of childhood injuries around the world. It came out with a report in December of 2008 summarizing the global burden of injuries for children. And it also suggested some very specific strategies which can be applied in different countries. In different countries, the risk of injuries vary by age of the child and the type of risk in that particular country. For example, in most developed countries in Europe, the greatest risk of injury is going to be in motor vehicle crashes. However, in countries such as Bangladesh and even China, the most common risk of injury is actually drowning. So there isn't going to be one strategy that works for all countries. It has to be tailored to the particular risks in that country. And the World Health Organization has been providing leadership for that, and I think we should turn to them to continue to provide that leadership rather than developing a new organization to combat the injury problem.
Thank you very much. Question number 6. What is the best way to prevent accidents for children up to 2 years old?
The approach has to be a very focused approach. There is no such thing as childproofing a home to make it safe for children. Rather, what we need to do is to focus on what are the specific risks of injuries to children and address those. So, as we said in the very first question, one of the risks is traveling in a motor vehicle, and using an appropriate sized car seat and having that in the rear seat is the way to prevent injuries to children traveling in cars. Those car seats are really very effective. Another risk of children is having skull burns, and one of the sources of skull burns is water coming out of the water tap. This can be effectively prevented by the use of either mixing devices in the water tap to lower the temperature or lowering the temperature setting on the hot water heater. Poisonings are also a risk, particularly for the toddlers. Those can be prevented through the use of child-proof caps. They've been very successful in countries that have adopted them in decreasing the risk of poisoning. An important part of that is to make sure that chemicals that are poisons are not taken out of these containers that are protected and put in other devices such as pop bottles. Fire protection can be achieved through the use of smoke alarms. They've been very effective in decreasing the risk of injuries to children. So the approach is one of very specific advice to parents about specific injury risks, rather than telling parents on the whole to childproof their home.
Thank you very much. Question number 7. My project research is to identify accident and injuries in public schools in Indonesia. I want to have more information about the standard safety school for children that can be in Indonesia, and about the physical hazards at school that can cause injuries to children, and prevention strategy programs at schools.
I'm not quite sure I understand the first part of this question, which is the standard safety school. There have been some attempts to kind of create examples for children of safety classrooms or safety environments. Those have not been terribly successful. The biggest risk of injury to children at school are actually falls, and falls off of playground equipment. Good methods to prevent those are, first of all, having safe surfaces under playground equipment. It should not be concrete, it should not be packed dirt. It should be something such as sand or wood chips or pebbles, or some other material that if a child fell could absorb the energy in that fall. Secondly, we need to look at the equipment itself. In our countries, we all have safety standards for workers that limit the height that we can place workers at. Well, if we look at some of the old-fashioned playground equipment, some of these children actually would exceed the workers' limits in terms of height. They may be up to 3 or 4 meters in the air on some types of equipment, playground equipment. So one thing would be to really look at the playground equipment and try to eliminate that kind of hazards. And then finally, we need to look at how children get to and from school. Are they walking to school? Are they taking buses? Are they riding bicycles? We need to work with the schools to try to make sure that children get there safely. If they are riding bicycles, they should all be wearing helmets. If they are walking to school, we should make sure that parents have gone over the route with the child and make sure that it is as safe as possible. And they can also walk in groups to increase their safety. So there are a number of things that schools can do to increase the safety of children and prevent injuries to children coming to school or at school.
Great. Moving to question number 8. Says, I did a research about child abuse in my city. He's from Minya City, Egypt. And I'm highly surprised from the results, as I did not imagine the horrible size of this problem. From your valuable experiences, what are the commonest predisposing factors in child abuse, especially in our environment, and what are the outcomes of this problem?
Child abuse is a serious problem in every country, in every society. We do know that child abuse has large consequences. And I think it's not just physical abuse we're talking about, it's also sexual abuse as well as neglect. We really talk about that as child maltreatment. Child maltreatment would include physical abuse, sexual abuse, and neglect. We know that the long-term consequences for children can be quite serious. It affects their long-term development and increases the likelihood that they themselves will be violent when they grow up and can abuse their own children. The risk factors and the causes of abuse are complex, but there are a number of things that contribute to it. One is poverty. Poverty is obviously a universal problem in all countries of the world, and poverty results in increased stress on families, low education, and increases the likelihood of abuse. Number 2 would be having grown up in an abusive household themselves. Children who grow up in an abusive household are more likely to be abusive to their own children than those who don't. A third factor would be substance abuse, particularly alcohol use. Alcohol is a contributing factor to many episodes of child abuse. And then a fourth factor is really lack of social support. As people move to cities, separated from their larger families, and live in isolation, that increases the risk of child abuse. There are a number of things that can be done about it, however. One of the most effective ways of preventing child abuse is home visiting by nurses early in the child's life. There have been studies in the United States, in New Zealand, and Great Britain to show that those home nurse visitors can be very effective in decreasing the risk of abuse. Secondly, it would be training parents about child development. Many parents don't understand that babies will cry. They don't understand the issue of the terrible twos and children having temper tantrums. Educating parents about normal crying, about normal child behavior can help to decrease the risk of abuse. And I think third would be is if we do have high-risk situations, is getting those children into daycare more so that they're not home with the parent all the time and providing some relief for the parents and stimulating environments for the children. So while it is a huge problem, it's not hopeless. There are things that we as a society can do in our countries to prevent child abuse.
Thank you very much. And our last question, can we prevent and how injuries in motorcycling one-wheeling or double-wheeling? What should be the first life-saving steps?
Well, I think there are a number of things that can be done in general to prevent motorcycle-related injuries. Probably the single most important is use of helmets. Motorcycle helmets have been shown to be effective in decreasing the risk of severe head injuries, and head injuries are really what kills people in motorcycle crashes. Second would be appropriate licensing rules. People should not be allowed to ride motorcycles without specific training in them and appropriate licensing. Third would be enforcement of the laws, particularly speeding laws and helmet laws. When those laws are enforced, we find out that close to 100% of people would in fact wear helmets.
Okay, Professor Rivara, thank you very much for taking the time to answer these questions. It was our honor to have you with us, and we look forward to seeing you up close in Istanbul shortly.
Thank you very much. I'm looking forward to seeing the people there in 2 weeks. Thank you.